What's up, YouTube? My name's Steve. I'm going to do some videos here and discuss my experience with and recovery from artificial disc replacement, specifically at the C6, C7, and C7-T1 level with a Mobi-C device. Start out with what led me to getting the surgery, and I'll cover my first day of surgery on this video. So, initially seen a surgeon who said herniated at C6-C7 pretty severely, mildly at C7-T1. You got two options. You can either have epidurals or you can have a fusion. So I chose epidurals. Did a series of 3 of those, and it worked wonders for about 6 months. Then everything came back again. Was having severe neck pain, shoulder pain, more severe right up underneath the scapula region on both sides. So went and had another 3 epidurals, and those didn't work. And fusion wasn't what I wanted, so I started doing some research and found where you could actually have artificial disc replacement, and got to looking into that and found the Mobi-C device. While on the website for Mobi-C device, they have a surgeon locator, and I located a surgeon out of Huntsville, Alabama, Dr. Cyrus Gavam, and that's who I chose for my surgery. Guess I went to him, and he looked at my previous MRIs. They were about a year old when he looked at them. He wanted to see some newer imaging. So I went and did an MRI for him. He got the results of them, and I consulted with him, came back to his office about a week after my MRI was done, and he said I had a severe herniation at C6-C7 and moderate herniation C7-T1. I had some cord compression going on, which was leading to the numbness in my hands and the tingling, and probably why the pain was getting worse. So he gave me an option of we could go through with the artificial disc replacement, or we could do a fusion. He said at my age, which I'm 34, he said I'd probably do better with artificial disc replacement, and that with that option I would have a less recovery time, and my range of motion would probably be a good bit better than if I had a fusion. So that's what I chose. About a month ago, I scheduled my surgery. Had to show up a week early for a pre-op appointment at the medical mall in Huntsville. Got all that done, blood work, paperwork, all that stuff. And then my surgery was scheduled for yesterday. I showed up at the hospital 10 o'clock, 2 hours before actual schedule of surgery. Got there at 10 o'clock. They carried me back to a room. We did my IV, put me in a gown. I spoke with a nurse anesthetist, anesthesiologist, and my surgeon prior to surgery. Just basic stuff. What are you allergic to? Are you allergic to anything? Any kind of complications in the past? Those type things. Surgeon came in, kind of told me what to expect following the surgery. He also did discuss with me that due to the angle of my spine and the location of the herniation C6, C7, and then C7-T1, that there was a slight possibility that he would have to fuse at C7-T1 if he couldn't get the artificial disc placed there. Which, if that's what he had to do, that was going to be fine. It's not what I wanted, because I need a quick recovery to get back to work, and I wanted to preserve as much range of motion as possible. But anyways, so we had that discussion. Everything was agreed on, and I guess they wheeled me back to surgery somewhere around 12:30. I I got to surgery, moved me over to the table. I guess I was in there about 5 minutes and they had me knocked out. Surgery lasted about 2.5 hours. When I woke up, first thing I remember was being in recovery and my surgeon being right there beside me. I guess they woke me up. He just started discussing with me how surgery went, told me that everything went as planned, which was good. He didn't have to do any kind of fusion. The 2-level artificial disc replacement with the Mobi-C device was successful. So it's definitely what I wanted to hear. Having a little trouble swallowing today, which is, I guess, comes after that surgery. Talk about the pain following surgery. Had a good bit of pain across my shoulders, on the top. I guess a lot of that was laying on the operating table for so long and the positioning they have to do whenever they're doing the surgery. Got some pain at the incision site. Day of surgery, a good bit of pain there, and just kind of some soreness throughout the neck. And probably one of the worst pains was actually when swallowing. Just from being intubated and them moving your neck all around and all that stuff, just you're gonna have a sore neck. You can let's see, coming out, what else do I remember? They have a drain. I had a drain hooked up to my incision site to pull blood off. The first thing for pain they gave me was fentanyl following surgery, which is some pretty strong stuff. Give me that. Then I guess after about an hour in recovery, I was carried back to my room. Second thing for pain I think they gave me was Dilaudid, which was a step down from the fentanyl. And that lasted for several more hours. Somewhere around 8, 9 last night, they stepped me down to morphine. The Dilaudid and the fentanyl was fine. The morphine caused a little bit of nausea, which they gave me Zofran for, and everything was fine after that. Like I said, I was in a good bit of pain, but they were keeping it knocked out, and I was pretty much knocked out too. I remember bits and pieces of yesterday, but not a whole lot of it. I know I wasn't able to eat. Throat was really too sore for that. I think I got probably half of a milkshake down, which was nice because it was cold and that helped my throat a lot. Got to sleep. I guess I went to sleep about 10:30, 11 o'clock, and slept on and off through the night. Wasn't comfortable. Didn't have to have any more pain medication throughout the night, but I didn't get a whole lot of sleep because IV pump beeping, coming in to check your blood pressure. Also following the surgery, I guess they use some steroids during surgery, and it raises your blood sugar. So I believe they came in and checked my blood sugar about every 2 hours to make sure it was steadily declining. But got through the night without, I guess, no kind of complications. So that was good. That was yesterday, and my next video I'll discuss today.